I'm currently placed at PACE Enterprises, which is a nonprofit vocational rehabilitation center for individuals with disabilities. And I go to PACE once a week for 3 hours, and typically I see up to 5 clients while I'm there. We do individual one-on-one therapy as well as group therapy. So with group therapy, we bring all of the clients and clinicians together and work together towards a common goal. With one of my clients at PACE, we're working on voice and fluency goals. She would kind of turn her head and was very, very quiet. And we just kind of wanted to increase her loudness, but also kind of slow her down so that she could be intelligible to all listeners. We found out that she liked to sing, so we introduced her to a microphone just to kind of encourage her to use her voice. It not just helped her with her voice and helped her communicate with others, but I think it also helped her with her self-confidence. In this field, we're not just changing something in a clinic and teaching them these goals. It's something that goes over into every part of their life. I think one thing that's very important about PACE and a learning experience from PACE is that everyone's different, and you might have 3 clients with the same diagnosis back to back to back, but they're all 3 working on very different goals. And I think that just goes over to show you that in general we're treating a person and not a diagnosis.